Hi everyone, I'm Maddie and this is my presentation on cultural awareness and diversity. My presentation will specifically focus on cultural awareness and diversity and its role that they play in healthcare and the treatment of patients. Understanding these terms can make one a better healthcare practitioner, provide better patient care, leading to more beneficial treatment results. It can also lead to increased patient compliance and increased successful recovery rates. Before I further jump into and define cultural awareness and diversity, I want to take a minute to define culture in order to have a better understanding of what my presentation will be about, because culture is the base of all things in society. Culture is defined as the way of life of a certain group within society that has been passed down from generation to generation. This can include, but is not limited to, art, literature, and technology. In a hospital setting, everyone is admitted as an open door policy. So as a healthcare practitioner, you will be exposed to all cultural and ethnic groups and be required to understand and be aware of their beliefs in order to provide proper treatment. As a future respiratory therapist, it is especially important to understand awareness and diversity in the hospital setting, especially for me, as I will be working in a more busy and diverse area at Johns Hopkins downtown campus. Johns Hopkins downtown campus is world renowned, and people travel from different countries to seek care here. They also have an international program where people are brought over from different countries to complete schooling at their university and eventually work there. That being said, cultural awareness is defined as the sensitivity and understanding of one's culture and their identity, and how their identity shapes them and their cultural beliefs and personality. Cultural diversity is defined as the variety of cultural and ethnic groups within a society. In the United States, different cultural groups can be Indian, African American, Caucasian, and Hispanic. All cultural and ethnic groups have different practices of medical care, a lot of them being religious based. This is very important to be aware of in a hospital setting because it dictates what kind of treatment we are and are not allowed to give the patient. In my presentation today, I have two different experiences that I would like to share about cultural diversity from the last 2 years in my clinical settings that I have encountered as a respiratory therapy student. My first encounter I would like to share involved the Muslim cultural group. My particular individual patient had a likely anoxic brain injury, and it was suggested that she be taken for a stat CT scan of the brain. Her family was present in the room and was obviously distraught at the physician's order for a head CT. Due to religious beliefs, she was not allowed to take off her hijab under any circumstances, and they were offended that the physician would suggest such a thing. If the physicians had had a prior conversation with the family members regarding their head CT and why it is so important, they would have had more cultural awareness, and in turn, they would have gained more trust and respect from the family members of the patient for her to receive better treatment options. My second cultural encounter that I want to share today is of the cultural group Jehovah's Witnesses. Jehovah's Witnesses follow a strict religious practice. A lot of Jehovah's Witnesses' religious practices intertwine with medical care, and as a healthcare practitioner, it is extremely important to be aware of this so that we are able to follow and respect their beliefs and practices in providing treatment. My particular encounter with my Jehovah's Witness patient had been in the emergency department after they had been in a motor vehicle accident and required a transfusion of blood due to trauma. But due to religious beliefs, he was not allowed to do so. The physicians at this particular hospital were very respectful and came up with an alternative treatment option in order to treat this individual. They treated him with recombinant human erythrocytes and immunoglobulin. Thankfully, this was successful in his case, but in more severe cases, this could have been less successful. It is important to make the family members aware of the risk of not getting a blood transfusion when necessary. What is also important is, as a healthcare practitioner, to respect his decision and be aware of their beliefs. I would like to end my presentation by saying how being aware of cultural similarities and differences and diversity among our population can not only be applied to healthcare, but in all aspects of your life, creating more meaningful, open-ended, and respectful relationships.